Hi, everyone. Thank you for joining. Before we start, I do want to draw attention to the interpretation services at the bottom of your Zoom screen. So if you are joining from Zoom, you can go to the select interpretation icon that looks like this, select the language of preference, and then select mute original audio. However, I will say the webinar will be mainly in English. Si está incluyéndose este webinar en español y quiere conectarse a Zoom para tener interpretación de idiomas en vivo, haga clic en el icono de globo de interpretación aquí, seleccione su idioma de preferencia y luego haga clic sobre el mute original audio o silenciar audio original. El webinar será transmitido en inglés y la mayoría del tiempo. Okay. So before we start, I'd like to note that there are interpretation services, and I made that note already. So good afternoon, everyone. Welcome to the webinar, Language Justice, Overcoming Language Barriers When Accessing Healthcare During a Pandemic. I am Rocío Cardenas, an intern with Alianza Americas, and I will be facilitating this conversation. We decided to bring this topic to address the importance of language access during the pandemic. Information regarding COVID-19 is not always accessible nor accurate when provided to individuals who do not speak or understand English. This impacts how individuals take precaution from being exposed to COVID, their understanding of testing and treatment, how they live their last days in hospitals, or no one might be able to communicate with them in their native language. We believe that health access and language justice are basic human rights. Individuals should not be excluded from life-saving information. We need to take those steps to ensure that everyone has the information necessary to survive this pandemic. In order to add more context into this conversation, I'm going to share a couple slides. The first slide that you see here is the number of languages that are spoken in 15 of the largest metro areas in the United States. However, this information is from the census in 2009 to 2013, so some numbers might vary. So as you can see, in New York, there were about 192 different languages spoken. In Los Angeles, there were about 185 different languages spoken. In Chicago, there were about 153 languages spoken, and so on. As you can see, English is not the only language that is spoken. And we have a lot of work to ensure that all these individuals are not being left out when it comes to distribution of information and resources. Moving on to slide 3. On this slide, we see a couple of headlines from news articles that describe the impact of language barriers during COVID-19. We know and the government knows that language barriers have a large impact on individuals during this time. So, when referencing language justice, we are talking about ensuring that people are provided with information in the language and format that is accessible to them. Some individuals are not able to write and read in their native language. So if you provide them with a document in their language, they will still experience an access barrier. They will not be able to read it. We also want to point out that health literacy is important, and we need to ensure that people are actually understanding what is being said in regards to their health. Finally, the use of professional interpreters and translators is important. We know that due to systematic barriers, young children and teenagers take on the responsibility of interpreters. This can have lasting impacts for both the child and the patient. This list in the screen is short, but it's a good starting point. I would now like to introduce our panelists that bring to this conversation their own knowledge and expertise. First, we have Professor Weisskirch, who is part of the Human Development Department at California State University, Monterrey Bay. He was an editor for the book titled Language Brokering in Immigrant Families, Theories and Contexts. We also have Mireya Vera, Director of Community Relations Assistant Interpreter Services for Holy Cross Hospitals and Sinai Health Systems. She has developed and implemented the best practices on language assistance and medical interpreter services. Finally, we have Odilia Romero, who is the co-founder and executive director of Comunidades, Indígenas, and Liderazgo, also known as CIELO. She is also an independent interpreter of Zapotec, Spanish, and English for indigenous communities in Los Angeles and throughout California. I would like to thank you all for being here today. As you might imagine, we have a lot of questions. I have a set of questions that we can start off with, and after that, we will also take questions from the audience. We have 3 different viewpoints in this webinar, so I'm excited to hear from each of you. We do ask to keep your answers to around 4 minutes to ensure that everyone has a chance to answer. Also, feel free to answer the questions in your language of choice. So, before we begin, I would like to hear from each of the panelists regarding their experience with language justice and why they do their work. Professor Weisskirch, would you like to go first?
Sure, I'm happy to speak on that. So much of my research has been around language brokering, specifically looking at how the impact of children acting as translators for their parents and other adults affects them both psychologically, emotionally, as well as within the family dynamics. And part of the reason that I focused on that was really to give voice to the voiceless, that many of these children are doing this kind of work and people don't pay attention of what is the impact of doing that. So from the outside, many people think, well, that is just unfair, or that is an unfair burden to put on children. But there's also some evidence that engaging in that practice is actually beneficial to kids, that they form closer relationships with their parents, and they, in fact, can perform better on reading. They have other advantages from engaging in that work. And so when I think about the work that I do, I think that this is a common phenomenon that has taken place for a long time that people have not paid attention to, and that the kids who are engaging in this work need to have the compassion and the understanding of the community within which that they're interacting. And so that's part of the reason why I engage in this kind of work.
Thank you. Mireya, would you like to go next?
Sure. And I think that's a good point that was just made. However, in medical interpretation, and this is specific to healthcare and hospitals, we are very cautious about using children because of the complexity of the conversations. And we have found often that children are being pulled out of school or our parents go to for conversations. This is a little bit of a role reversal where the child becomes a parent. And that's why we like to provide qualified and trained interpreters. But I think it is encouraging, and I have seen the difference that with children being used in this adult role, they do become more responsible and develop a closer relationship with their parents. We're just cautious, especially in the emergency rooms, when it has to do with medicines, the amount of medicine, or a child might not be able to capture all of that information and turn it around in another language. And of course, depending on whether the child was born and raised here or has recently been brought in from their country of origin.
Odilia?
Hi, well, I was a child interpreter. So my first interpreting was probably, I don't remember exactly, but it was to pass the state barbershop for someone in my community from Zapotec. I don't remember if either to English or to Spanish. Nevertheless, nor I wasn't fluent nor in Spanish nor in English because I had only been in this country for about 4 years. So my English and my Spanish were extremely limited. At that time, I was extremely fluent in my own language. And based on that experience, I see that all the time that Indigenous children has to be the interpreter for the families. And that is very unfortunate I get what Rob is saying, sure, you become more responsible, you mature like really early on. But in the case of migrant Indigenous people currently, you're coming through the bestia for the Central American brothers and sisters. You have been raped. There's cancer. There's COVID. I cannot imagine myself as a child being able to interpret the complexity of a rape, the complexity of COVID, of an intubation. So yeah, that's my experience in being a child interpreter.
Yeah, Odilia, I can also second that. I think I also served as a child interpreter when I was younger, and I think there's both positive and negatives to being a child interpreter. Like, I know that a lot of my responsibility and my current personal experience has been due to that. But like you said, I can't imagine being translating or interpreting during those kind of situations. So moving on to the second question, how have language barriers impacted non-English speakers during this pandemic? That can be from accessing accurate information to affordable testing and treatment. Mireya, would you like to go first?
Sure. I've seen firsthand how it's impacted many of our community members, our patients. It's a very heartbreaking situation when there is no qualified trained interpreter there, or just being a qualified interpreter at the bedside. This COVID has impacted in significant ways, not being able to say goodbye to the family, or the family standing outside the door and not being allowed in, or a family member, just left from Mexico and now needs to come back, but he can't get back in the hospital. It's been a really, really tough situation in our community, and many of our community members are essential workers in the area that we serve at Sinai. Obviously, not all Latinos are essential workers, but it's been a huge impact in the little village, the Gage Park, Pilsen, and we just have significant Latino populations. And it's hard when they don't understand. And then on top of it, you've got a mask. So you're not really hearing well what the person is saying. And so using a video is even harder, because then you've got the interpreter trying to hear both the patient and the doctor with a mask on. So it's been a difficult situation for our community, this COVID situation, and they're scared. And then they might get sent discharged, but then they can't go home because they need oxygen, and the family member, because there's an older person, we know we have multi-generational, doesn't want them home yet, because that 4-month-old child and the 80-year-old in-law, you're going to have to stay somewhere else. And so then finding hotels, it's been a real difficult situation for our community, having to deal with COVID.
Professor Weisskirch or Odilia, would you like to contribute?
I would. So a couple of things in terms of accessing information and things about testing is, one is there are lots of youth and children who may be bilingual but may not be biliterate. And so although they can speak the native language, they may not have the same level of literacy that they have in English, or not have full literacy in English, and then are stuck really trying to put together the information from both languages. In addition, there's also some new research that's come out that social media has been particularly bad at picking up misinformation about vaccination in Spanish. And that is really distressing, because nowadays everybody's on all kinds of social media reading about updates and information. And if social media can't do its job in terms of flagging misinformation about the vital vaccination that needs to take place so that we can get through this pandemic, then we have a problem. So it's the responsibility of the community now to go forward with that information that's accurate when things float around social media.
That's very important to know.
Okay. Well, for Indigenous people, it's really hard to find out how many have been impacted. We know because we know the communities. We know, like, when the mechanic passed away. We know when the rezandero passed away. But because we're labeled as Latinos and Mexicans, it's really hard to show numbers of how deeply COVID has impacted us. We have some informal numbers that we've collected at CIELO, but there is in Los Angeles, like, for example, we did some videos that we had to do because the state wasn't doing it. The pro-immigrant rights organization were not going to create this information tool for Indigenous people. So at the beginning of COVID, CIELO created videos in different Indigenous language on the prevention of COVID, right? And now we're just launched a video campaign for vaccines, but it always has to be that community, us, doing it. As Indigenous, and we're always underfunded too as an Indigenous organization. There's only about 5 of us nationwide. And when you end up in a hospital, my mom was in the hospital for 10 days. She tested COVID positive. There was no one there to speak in her language. I couldn't talk to her because she got into a deep depression that she couldn't come out of it, you know. But there was no one in Zapoteco there to speak to my mother. I think she had an interpreter over the phone, and of course the mask. And I heard different community members like not being able to talk to their family member once they're in the hospital with COVID. There's no information in their languages, and there's this now trend to produce material written in indigenous languages, but it's only for the interpreter and maybe an academic that knows how to read the language, because the farm worker, the essential restaurant worker will not be able to read this, right? So they create it for themselves, and it's a check the box thing. Like hospitals do it very often. Like I'm a medical interpreter, and I've gone to many hospitals to interpret in LA County. I run into a lot of indigenous people previous to COVID that did not have an interpreter, that agreed to a surgery, that signed the consent form without an interpreter. And that just has increased much more now that a lot of us are not able to go interpret for some of these family as indigenous interpreters. We have a network of 200 interpreters trained. We're constantly training them, because that's also the limitation that we have as indigenous interpreters. Like, our languages are not certified. There's no tests, but also the vocabulary that comes with COVID currently, you know, is really hard. It's like putting these Western language into an indigenous worldview and vice versa, you know? How am I going to explain vaccine? That all comes into account. So no, it's been devastating in our communities, and we don't have real numbers.
That's true. Word by word translation is definitely not accurate when it comes to translating across cultures and different specific words that are only known in your own language. And I think it's also important to know that it is hard for Spanish-speaking individuals to access services in their language, and that's thinking that Spanish is one of the languages that are actually provided. And then thinking about indigenous languages and then other languages that immigrants speak, that's languages that are not even available to them. So that's also important to know that there's immigrants from Africa or Asia, and those languages are not even as accessible as Spanish. So moving on to thinking about the children and youth translators, can you identify any potential impacts on children or young adults who are currently serving as child interpreters / brokers for their parents who might be receiving COVID-19 treatment? And also thinking about these youth interpreters who are translating from outside the hospital because they can't physically be inside the hospital room with their family or their parents. What kind of added stressors can you identify? Professor Weisskirch, can you start?
Well, I think the emphasis there is on stress, right? That many of these youth are having to interpret at a distance in ways that they wouldn't normally have to interpret. And I agree, ideally the medical interpreter is there, but when you live in a non-urban area, so I'm in a non-urban area, there aren't that many translators. So if the one Spanish speaker is being engaged, then somebody else has to fill that. So you have to hope there are staff who are competent or a child is competent. And same thing with indigenous languages, right? There may be one Mixteco interpreter who has to engage in the entire county. So the child then becomes the next proxy. And I think the challenge is really in the child not having complete understanding of vocabulary in either language, right? That they may speak. So for example, you may be used to using the word belly, right? But the actual term might be stomach, but the kid knows it as belly, and trying to interpret that conceptually is a lot harder. And then we get on top of that medical jargon, right? And I think on top of that makes it very challenging. So kids get pulled between the stress of really trying to help their parent or other adult or relative, and the obligation that they have to keep their own emotions calm while they're trying to interpret something that they know is really scary. For many of the kids who are English proficient, They know how scary some of the results are of what happens with COVID. So when they see their loved one, I think that can be very stressful and a stumbling block for them to provide the kind of care and the kind of advocacy that's required once their relative gets into the medical system. On top of that, many of kids are not used to interacting with the medical system. They don't know that you can ask for a medical translator. They don't know that hospitals often have telephone services for all kinds of languages. They don't know to ask that because there are few places where that is provided and kids interact. So some of this, the added stressors are around just the seriousness of the situation, the incomplete vocabulary they may have, and just being a kid placed in that kind of position, trying to help their loved ones and not knowing how to interact with the system.
Professor Mireya, do you want to go next?
Sure. First of all, I need to say that there's a difference between interpreting and translating. So the interpreter is the one who does the verbal communication from one language to another, and the translator does it in the written format. So you take a written piece of material and you convert it in writing into another language. And so that's a whole different set of skills. And you know, it's commonly used, you know, interpreter / translator, but correctly, it's an interpreter. And then the translator dedicates to the written piece. I can't say enough about this piece of using children and youth. It is in difficult situations, especially when it comes to COVID, you know, life and death, traumas, to put a child in that role is psychologically abusive. It really does more than stress to the child. It can cause trauma. And I've seen it myself in a situation where a patient was brain dead. And when the family member asked me, the interpreter, and according to the physician, they had already shared with the family that the patient was brain dead. But when the family member said to me, when will he ever, you know, stand up or speak, or will he always be a vegetable? I knew then that they had not understood the term brain dead. So when I asked who the interpreter had been, they pointed to a 10-year-old child. And so within the 2 minutes that I said to the physician, we're gonna have to start all over. And when he explained what the brain death meant, and that was a condition, then everybody fell apart crying. But the toughest thing for me was to watch that 10-year-old faint, get absolutely beside herself. She felt guilty. We put on a lot of unnecessary grief on this child with the situation. Office of Civil Rights says that we should be using trained and qualified interpreters. And we know that there are rural and, you know, suburban situations where they may not be a qualified trained interpreter there in front of you or accessible, or a bilingual staff. But, you know, we really need to consider those options. Telephonic options is always going to be better than using a young child to put them in that kind of a psychological situation that can not only cause trauma, but guilt that they will carry the rest of their lives. And I have also seen interpreters that were used in a situation of rape. And this individual, to the age of 30 something, talked to me about the trauma that caused her and why she remained single and a virgin. So, you know, it's beside us that we should be using ever. And I teach medical interpreting as well. So I talk to folks, providers, nurses, which of you would ever use your child if you were in another country and they happen to speak a little bit of that language? Which of you would use your child to be your interpreter? To date, in the 15 years I've been teaching, nobody has ever raised their hand. So it is not something we should be doing.
I totally agree 1,000% with Mireya. For us as Indigenous interpreters, of course, we don't have the privileges of Spanish interpreters, right? That's another thing that when we talk about interpreters, we don't have that proper training. We don't know it's a career. We become an interpreter as kids because of a need in our community. As many of you know, only 1% of Indigenous people make it to higher education. And much less of that amount finishes with a degree. So there's very few of us that are trained as interpreters. And then there's very few Indigenous trilingual interpreters like myself. Most of us are relay interpreters. And the secondhand trauma that interpreters go through in Spanish, English, French, it doesn't matter. There's a secondhand trauma. And you know, Spanish and English interpreter, you could go to training, you have access to a psychologist, you have access to therapy, if you have health benefits, right? If you're like a permanent interpreter somewhere. In our case, some of the interpreters are farm worker. They don't have access to therapy, you know, and then a lot of of us, because we didn't go to school for interpreting, we borrow a lot from Spanish. I'll use an example. Re you enfermedad, je colesterol. Tú tienes la enfermedad que se llama colesterol. But if I had a training, I would say, re you yishwe, za you chenchu, chen colesterol. Tú tienes la enfermedad que se llama colesterol. En nuestra lengua se dice que tienes grasa en la sangre o aceite en la sangre. Big difference, right? But most of us borrow from Spanish because we don't know the word, because we haven't had the proper training and go to school. And that gets lost a lot. A lot gets lost. So the patient doesn't know, why was this patient brain dead? Because they don't have the words. They haven't had training. So it becomes very complicated for Indigenous people to interpret in medical field, not to even mention legal field. But and the other thing with the telephonic services for us is not that they don't always have our language. And for example, out of the 68 Indigenous language families in Mexico, there are 364 variants. And for example, I'll use an example. I'm Zapotec, my husband's Zapotec. We're both fluent in Zapotec, but we could never have a conversation together. I mean, our conversations at home happened in English. So the language lines do not have the questions to get the right interpreter. So if Mireya needed an interpreter at her hospital, she'll probably to go 10 Zapotec interpreters before she reaches the right one, right? And by that time, the person's probably dead or the surgery already happened. So it gets very complicated for us as Indigenous interpreters and Indigenous people here in the US.
Thank you. And going off of that, I'm wondering, I know we can all agree that using children and youth to translate or to interpret is very much not ideal, but unfortunately we live in a society where we're still not providing the interpretation services on a need-based basis. So what are some, if that's the only resort that the individual or family member has to receive services in their language, what are some ways that healthcare providers can assist the child during the interpretation to reduce the trauma or trauma effects, if any of you would like to answer?
Well, the whole point is like, we shouldn't use a child. It's like, there's no options here. We shouldn't use a child. There's no way you could prevent trauma. There's no way you could prevent this. Once a child is interpreting, I mean, there's no way you could reverse that. So our goal from the immigrant right movement, from the hospital, from the courthouses, we should make a major effort to train interpreters, invest in interpreters, and in the case of Indigenous people, invest in Indigenous organizations to provide highly prepared interpreters and never use a child. Just like that question that Mireya asked, would you use your child to interpret? Well, no.
So I do want to jump in that I feel like this is moving a little bit into blame the victim, because there are no parents that willfully are using their children. They're using their children because they have no other choice. And I take quite umbrage of saying that it's psychologically abusive to do this, because I don't think that is in fact the case. I don't think there's evidence for that. There's in fact evidence that some kids just treat it like they're just translating. Now we're talking in a COVID pandemic situation, only in medical issues. And yes, it is absolutely not the preferred, but if you have no one, but you have a kid who speaks Zapotec to help interpret even a little bit, it's better than no communication. So I feel like families are doing the best that they can with the resources that they have. So until we get to that place where there is ready interpretation services in all our communities for all the languages, this is the reality, is that kids are in fact having to move into that position, teenagers, young adults, because that is what's required. So I think that we need to move beyond that and help the families learn how to support their translators so that the impact is far less. And this comes with good relationships within the family and support for those kinds of communities.
I respect that, Rob. I think, I know that many hospitals and healthcare settings are in situations where they do not have the resources. But the reality is there is a law, the Office of Civil Rights, Title VI of 1964, which clearly states that we should not be using family or children, in particular children. And that's under the Guidance Act of August of 2001, signed by Bill Clinton. So there are legal requirements that all hospitals should be adhering to in all healthcare settings. And we know that families do go to children as the first resource when a healthcare setting has not offered them. And that's about training families and training our communities to say, you have a right. This is your right. Legally, hospitals should be providing for you interpreters. And if in that interpreter shape it's bilingual, an employee, well, then so be it, preferably a clinical bilingual employee. And the more need there is, the more a hospital should be considering of having a telephonic service. And basically with that law, that's what it's saying. You should all be requiring trained and qualified interpreters. So we can do that through telephone services if we don't have, 100 or more patients a day in a particular language. And if we are, then we really should be looking at the investment of an interpreter for that setting. And there's even community groups, community organizations, promotoras de salud, that will send in bilingual staff to help out with a patient, so that we're not putting children in those situations. And you're right, they're, parents, it's not their fault, and this is their go-to, but it's also a situation where when we're pulling children out of school, that's impacting their academic performance as well, of missing classes, of trying to catch up. So it has this vicious cycle kind of impact, but it's something, it's not an easy fix, especially like you said, in languages we currently don't even have adult trained interpreters in. And that is something we need to continue to advocate for, because we should not be in a situation like this, or in this country in particular, where we know we have a variety of languages spoken in each and every state. There is not one state in this country that has English only. So we really need to consider what we're doing in a medical setting in particular. And a very simple, benign example of watching a child interpret for a dad in an emergency room. I just happened to be walking by as I heard the doctor telling the 12-year-old son, please tell your dad he needs to take this medicine for his diabetes once a day his antibiotic, it wasn't diabetes. It was an antibiotic once a day for 7 days. And the child turned around and said, Papi, you need to take this 7 times a day for a week. That's what the child heard. So fortunately, I was in that environment and was able to correct the conversation. But it's so simple for a child who's nervous to not hear it all and miscommunicate and put an adult in a worse situation. So these are all considerations that we have to think about.
And Rob, I get you. Like sometimes we are the only resource for the community, but the institutions, the hospitals, the organization, we have to do our work for this not to happen. Obviously, we're not going to stop it today, and it's going to happen throughout the U.S. Especially in Indigenous language, because there's such limited trained interpreters. But we need to change that. We need to make that shift and prepare more interpreters. But it's up to the hospital to abide by the law. A lot of the hospital I've interpreted at, there's a lot of racism towards Indigenous people. I once heard one of the nurses said, we have to dumb it down. It's a person from Oaxaca. Another nurse told me in an orthopedic clinic, and how do you people survive speaking another language? That racism prevents us from getting an interpreter, because they could make a call and say, hey, let me call language line and see if I have a Mixteco interpreter. But then there's no need to scream around in the department. We have to dumb it down because it's a Oaxacan. The racism comes in there too. So there's a lot of work that we need to do. It has to be the employees at the hospital. They need to be culturally aware of what population they're serving. In LA County, I'm going to show you the map if that's okay. This is the first numbers that we've collected of the large percentage of Zapotecs. No hospital here has a Zapotec interpreter. And I'm like, why? Well, you don't have numbers. Well, here's the first number, but that's not going to make them hire the interpreters either, right? So we need to make that shift. We need to push the hospitals, the clinics to provide interpreter and to abide by the law.
Thank you. And as you all mentioned, we don't want to put the blame on the family, but more holding the system and the hospitals accountable for providing these services. Because when a child is used for interpretation, it's not necessarily as a choice, but as a last resort when systems fail. So now moving on to the experience that individuals are facing when they're in a hospital during this pandemic and don't speak English. Don't speak English, and nobody is necessarily speaking to them in their native language. What are the effects and what does that experience look like for these individuals? Mireya, do you want to go first?
Sure. This has been one of the toughest situations that I've witnessed, because sometimes by the time you get to the patient, they've already seen a couple of healthcare individuals and nobody's understanding their language, or they've used a video and the interpreter on the video is not hearing well, and so the patient is more scared than ever. And I know that not all hospitals have, or healthcare systems have on-site interpreters accessible or available to them. But I will say it's very, very frightening for the patient. As simple as a phone. Not every one of our patients has a cell phone. And we think that because the majority do, our seniors come in that they can't hear well and they're scared. And why isn't their family in there with them? So having us there at their bedside has been a huge blessing for the patient and for us, the employees. Because, these are not ideal situations especially in our culture. We are a close culture and we need to have our family with us. And it's very difficult to understand why they can't come in while we're trying to keep everyone safe so that you're not coming in and exposing yourself to COVID and then taking it home to others. As I said, it's not unusual that we have multi-generational homes that we live in and close quarters, right? Small apartments. And so, we have to consider those things. And when we shut down to not allow our visitors to come in, it was extremely hard on our patients. We often were called in to help them hold the phone if they were intubated so that the family could say goodbye to them. Saying goodbye in those moments is, even for an interpreter, is heart-wrenching to see as the family's talking to their loved one while they're intubated in bed. And, then going out to talk to families who's waiting outside and saying, could you at least take this phone to my family member because I have no way to see them, to talk to them, and not allowing them in. So we were doing the running back and forth between the outside families and, questioning their family and then the patient. And then, of course, that there's HIPAA, and HIPAA doesn't allow you to talk to everybody. You have to have one representative. And in a family where there's 3 or 4 or more siblings and everybody is, used to being in charge, that was another cultural challenge between the hospital and the family. But why does this other sibling keep calling? I said, because in our culture, we take that moment to share, but we need to be involved in our parents' care. So it's explaining to the family as well. We require one representative. Do you think you can assign one, and then you guys talk later together, but we'll be as accurate as possible with the information. And saying on the telephone your family member's not doing too good, or your family member may not make it through the night. All of those are heart-wrenching communications that we have to have. So we always want to make sure we're doing it with a trained or an interpreter. And that we have bilingual staff as well, that we assess their language skills and how fluent are they in Spanish, so that we make sure that the communication is accurate. So it's really critical that we have accessible individuals who are clinicians or interpreters that are completely bilingual.
Thank you. Odilia, do you want to continue?
Oh, well, what Mireya explained is, I felt it very close to my heart. Like, there's 4 of us in my family, and when my mom was in the hospital, the nurse at one point said, "Why are so many people calling?" And I know hospital protocols. I know I shouldn't be calling, but at the end of the day, it's your mom, and you call and you're like, can you try putting her on the phone? Why isn't she responding? Why isn't she wanting to talk to us? And they told us multiple times, only one of you, and could be the lead. And it was heartbreaking. And mind you, all of us are fluent in English. We're all fluent in Spanish. I cannot imagine what a family that doesn't speak Spanish or English has to go through to find out information about their loved one during this difficult time when you can't see them, you can't talk to them. Maybe you don't know how to use the FaceTime on the phone. At one point we had a very generous doctor that out of his personal phone, he's like, she's doing better, and puts her on the screen, right? But then at one point, we had to make the decision only one sister could call, because the cultural differences too, right? So for Indigenous families, like for me, like we talk to a lot of people every day, because we have like a food pantry, we have cash support, we have a interpreter program. And some of the most impacting thing is for me was a man said, I'm a widow. I was working at the garment industry. I got infected with COVID. She got infected. All the kids are infected. She did not make it, but we could never see her again. Once she was in the hospital, we never talked to her again. We didn't know how to communicate where she was. When they called, they said she was gone. Now we have a newborn. What am I going to do? Like, those are like the stories that we are hearing in Indigenous communities here locally in Los Angeles. When you hear like these stories, you're like, well, how would you even communicate with the doctor, right? So it's been very challenging and heartbreaking for us. For me, as an interpreter, also as a community member of an indigenous community, is just talking to the pueblos is just heartbreaking. I mean, devastating for us emotionally, for all our staff too. Like having to hear the story, I couldn't communicate with my loved ones in my language. So
I just want to add one more piece, because I think your question was about what is it like for the person who doesn't understand the language. And I think a lot of how scary that must be, not just for themselves, but also just the ambient sounds that take place in the hospital, that people come in, they go out, and you don't understand what they're talking about because you don't speak their language and that's not being offered. So I think this is the place where I think, like Odilia said, of really advocating to make sure that the care staff, the nurses, and anyone who comes in is treating the person who may not be fluent in English or another language that's readily available, to really work with them with the level of respect that they have for anybody else, that they ask them when they're in pain, they tell them what they're going to do, they tell them what kind of medication as best as they can, providing them with the vocabulary. I can't imagine nursing staff that wouldn't go in and at least help them use the words for help or pain or whatever is required in a way to provide some communication and some care for the patients. In medical situations, a lot of times things happen very quickly. And so a lot of times there's not the opportunity to slow down, but I think that's where the family needs to advocate, to go in and say, nope, you need to slow down and tell them what's happening as best as you can.
Thank you. And that's a perfect segue into the next question. Based on your experience, what should hospitals be doing to ensure that they are lessening these language barriers for anybody in the hospital right now? Mireya, can you go first?
I think we could talk about the ideal, but it's also, you know, as we have all said repeatedly during this webinar, the reality is another story. But what we should be doing, I think, is really, first of all, be aware of who your community is. Knowing the community you serve really should give you at least an intention of how to prepare. If you know that 10% of the population in your community is Spanish speaking or Bosnian or Mandarin, then in a crisis such as this, you really need to plan ahead of time and say, you know, what are we going to do when these individuals come in and you're trying to explain to them what COVID is, and as you know, Odilia said earlier, then there's not even written material on top of it that you can give to, you know, a patient in the emergency room to look at and try and make sense of what they're going through and how the spread works so quickly, and why this a vaccine is important. So, you know, we really have to try and plan ahead. If it's, you know, signing up with a telephonic interpreter company, most of them have, you know, they'll tell you from the get-go, we offer 200 languages. So if you have a unique language that you don't usually see there, I mean, you could see it right on their list. And then it is about saying to this company, you know, this is a high requirement for me. We need Zapotec, we need Mixtec, you know, we need Urdu. There's so many different languages and idioms that are not strong generally, but there are populations that it's just so important to have an interpreter in. And there's also consideration to working with a community organization. If a community organization, you know, does non-for-profit work of helping them navigate legal systems or navigate healthcare, or you know, let's set up a program where we can talk about interpreting, and that, you know, these individuals could be community representatives for patients and be called in, you know, as volunteers or with a stipend whatever it may take. But I think it's critical, absolutely critical, that in this time of crisis, that we be able to communicate with patients in whatever language they speak. And the telephonic agencies and the video remote agencies offer a variety of languages. And for on-site interpreters, it's always going to be the ideal, the better, because especially in a time of crisis, that's when you need to see and hear and feel the individual. In addition to, the masks, it's just so much harder, like I explained earlier, to understand through a device, but it is better than using a child or not to have anyone there at all. So there are very many creative ways that we can lessen the language barriers and learn to understand our patients, because we're not in veterinary medicine here. We are in healthcare, and it is a social human right.
Rob, would you like to go next?
I agree 100%. Couple of things I would think to add there. One, I do believe that hospitals serve the communities, and the pressure needs to be put on the individual hospitals to provide the services to more effectively serve their communities. So this means the big healthcare systems going to the board of supervisors for the county hospitals to advocate to make sure that there are ways to fund and support the interpretation services that are required for the community. And then the second thing is, there's got to be a bottom line cost to this, right? That it's got to be more expensive to not provide the care, to continue to provide acute care instead of getting into the prevention. So I think with effective language services, you can enact those prevention services that then eliminate some of the more costly interventions that need to take place later on. So if we can continue to present that as the point of investment in language services, then I think we'll get movement from some of these big systems.
For me, it's been very challenging to have this conversation with hospitals. I will use an example. We've been doing training with LAPD on how to better serve Indigenous people and how to identify the languages for the last 10 years. That happened, they killed someone that was Indigenous. That's when they finally sat down and had this conversation with us. But we cannot do that with hospitals. We've been trying to reach out and how do we work together? Like, there's this population here, and they respond, do you have data? Well, we don't have data. Now we do. But I think it's very important, like for hospitals, for clinics, to know the population they work with, like Mireya said. That's key. And let's talk about racism. A lot of in the case of Indigenous people, a lot of the service providers, the clinicians, they are Latinos or Mexicans, and they already have a certain idea of an Indigenous person. And for us, our biggest enemy or biggest allies is the Spanish English interpreter, because they are the one that will notice if we're not having a sentence correctly. They will notice that language gap. And they will be the one that will say, hey, do you need a Zapotec? Do you speak another language? Can I get you an interpreter? But if that Spanish English interpreter is not informed about the diversity of Latin America or other cultures, that access to language, to an interpreter, will never happen, and it's a violation of our human rights as Indigenous people. But that constantly happens. Like, I ask all the Spanish English interpreters, you are our biggest ally, and it is in your hands for us to have access to an interpreter in a critical time like COVID. Like, think of us as human. That's all I ask.
Thank you, everyone. I have one more question before we move on to questions from the audience. So if the audience has any questions, you can start putting them in the chat. But Moving on, we are currently in the vaccine stage of COVID. We just recently got some vaccines out, and there's a plan for implementation. How should information on this vaccine be handled? And how can we ensure that the people are receiving accurate information to access and be able to access this vaccine? Rob, do you want to go first?
I think one, as many people have reiterated, needs to be in multiple languages to the communities that are being served. That's for sure. And also the right media, right? Lots of Latino communities are very radio oriented. Radio ads need to go out with accurate information, with influential figures that talk about the importance and the vital asset that is getting a vaccine and continuing to be healthy and using the preventive techniques in order to keep the entire community healthy. So I think that the best way to get the information out is using the media and the right source, as well as using local trusted people to be in the communities to get the accurate information out. There's so much bad information, there's so much rumor, that I think that lots of people can easily get caught in thinking they know something is good or bad for them without having the accurate information. So I think it's important to use both the media as well as local individuals who have high prestige, high influence to get the message out in the language of the people who need to receive it.
And Odilia, you can answer next. I remember you mentioned earlier in the webinar that, especially for Indigenous languages, using Western language can be hard, and how to translate vaccine into that language. What is your opinion on that?
Well, yeah, we have to use, again, I'll use LA County, right? We've been here for more than 15 years. It is this current time that they're noticing of our existence. We got our first batch of vaccines for Indigenous elders that are 65 plus, because with the COVID, they came a lot of our elders passing away, knowledge, language, also, passing away. So we've been pushing county with our data now to have this vaccine. And I think some of the things that we're doing is we all our coordinators speak another Indigenous languages, calling the hometown association and saying, we have vaccines available. Can you please give us a list of your hometown association members that are interested in the vaccine? But we're working directly with Indigenous communities, but also we're developing videos, audio that could be sent through WhatsApp, and that could be shared on Facebook. A lot of our communities use Facebook, but we're not doing anything translated, because again, we go back to the level of education. So everything is in audio and videos and animated videos to push the vaccine out. So you'll be seeing them on our webpage and on our social media within the next days, because they authorized us the vaccine on Wednesday. So now we have to do all this and have it ready to go have people go get the vaccines tomorrow, so that's how these institutions work. They'll tell you the day before that you have these 100 vaccines. So all of us are running around trying to get this information out, right? So.
Rocio, would you mind repeating that question? I want to make sure I capture all of it.
Yeah, so with the new implementation of the vaccine plan, how should information on COVID vaccine be handled, and how can we ensure that people are receiving accurate information?
I've seen that several hospitals have put out written information. Our healthcare system in particular has put it out in English and translated it into Spanish and a couple of other languages. But I understand completely not everybody reads or reads at that level. And so it's not just about having translated material. It's usually good. We like to give it to our community-based organizations that then, pass it on to las promotoras or patient navigators, that they can then use this as talking points to explain to their community. but it is not only word of mouth, it is about, taking away that disinformation. It's so important for the community to trust you, because when they don't trust, they're not going to trust the medicine that you might be providing, which is, a vaccine. If they know of situations that have not gone well, or situations where, an interpreter was not provided and something went wrong, then the trust is gone. And so we really, it's not only a public health issue. We want to make sure our patients, our community members understand completely why the vaccine is important, and understand when they see disinformation or misinformation, that it is just that, misinformation, and what they're being told from the medical side or from a community-based organization, that this is known to be true, because we want them to be comfortable in coming to get the vaccine. And it could be that even from their countries of origin, vaccines did not go well when they were offered in that country. And so therefore that their whole idea of medicine is skewed, and you're not always comfortable, right? So it really is about knowing your community, and tackling it from that angle, and using community alliances, community partners that can help you, infiltrate the right information into your community, and know that eventually these community members could potentially be patients of yours. So it is much better to be proactive than trying to be reactive once they're in the hospital and saying, oh, well, you should have, or you could have, or it's just, let's do it right by being more proactive and getting out the information in the media, whether it's Facebook or tweet or whatever social medias there are, and in writing, having flyers, and through community members, the word of mouth. So it has to be, those multi-tiered levels that we're trying to address this issue to our community. But we know vaccines are one of those, even when you understand English well, not everyone wants a vaccine.
Thank you. We have a couple questions here from the audience, and one of them goes back to the topic of children interpreters. So when children are asked to interpret for their families, how can health providers verify their language abilities and their ability to understand the subject that they are interpreting? I'll leave it to anybody to answer.
Well, they can't, right? They can do the best they can. But I think sometimes in quick situations, medicine moves very quickly. And this is a case where it needs to move very slowly in terms of asking the child or the youth, what is it that you heard me say? Verifying that the information is there as best as they can, only when a qualified medical interpreter is not available. And I think that that's the big challenge, right? Is that parents who don't have a choice bring their kids into that situation. And the only way really to verify is repeating back, doing the best faith effort you can to see if the child understands what's happening. There are certain things I would not move down to children who are very young. I think there are some things that you have to be cognizant of what kids would be able to understand. So a 7-year-old is not going to understand sophisticated concepts. 15-year-old better, not great, but still better. And I think you have to be aware of the developmental level of the child.
Thank you. The next question is said in Spanish, so I'll put it in the chat in English. But the question is, comentaron que existe una ley que obliga a las instituciones a proveer un intérprete. Muchos de nosotros desconocemos ese derecho. ¿Cómo se puede hacer valer ese derecho en un escenario continuado de cortes o hospitales?
I could try and answer that. So it's the Office of Civil Rights Title VI of 1964, OCR. And under that law, it says that if you receive federal funding, you have to offer the services without delays or without discrimination. The same way you're offering it to an English speaker, you would offer it to a non-English speaker. Okay, so it's really important that our communities understand that they can ask when they walk in for services into a healthcare setting, into a hospital, do you have interpreters? A hospital should never be requiring, and it could be deemed as a violation of this law if we say to them, no, we don't, you should come back when you have your own interpreter or when you have someone who speaks English. That's a violation of the law. It's deemed discrimination. We're delaying services because you don't speak the language. So it's based on national origin, and it's based on religion. It's everyone who lives in this country has a right under this law, OCR Title VI. You can look it up on the website to a qualified interpreter.
Thank you. Anybody else want to jump in, or should I move on to the next question? Okay. So the next question is also asked in Spanish, so I'll put the English version on the chat. But ¿qué tan comprendidos están los estados en apoyar, ¿qué tan comprometidos están los estados en apoyar el trabajo de interpretación? ¿Con quién debemos hacer el cabildeo para que esto sea una prioridad? How committed are states to supporting interpretation work? Who should we lobby to make this a priority?
Well, I don't think the states are committed to this, right? That's the reality. It always comes from the grassroots organization to advocate for the rights. So I think, you know, knowing that that there's a law that exists, again, it will be up to us, the small organizations, to educate and inform our members, our communities, that they have a right. Because you cannot request an interpreter if you don't know you have a right to an interpreter, right? So there's a lot of work to be done, but definitely it's not an interest of the state for us to have language access.
And I could also add that there are several states in this country, 12 of them in particular, that have laws around interpreting. Here in Illinois, we call it the Illinois Language Assistance Services Act. So it's a piggyback to the federal law, but there's several states that do have laws. And so you can reach out in addition to working with grassroots organizations, talking to your alderman, talking to your representative, your public official, sending letters to your congressman, on behalf of community groups. But they have to hear that there's a need. And that's how these laws were enacted, because we in the 1990s, based on what we were seeing in the state of Washington, and we were 10 years behind them, we then moved forward with a law. And I know at that time, California, and this was in the 90s, was working on a law themselves. I don't know if it was ever enacted or passed, but I know there are several states that do have these laws that give patients the right to ask for an interpreter, a qualified interpreter.
I also think that this is a place where allyship is particularly important, because certainly local communities that are very small advocating, so let's say a Zapotec speaking community is coming forward saying they want better care. This is a place to ally with, for example, the nurses union, right? Nurses want to provide high quality care, and they know that they can't help their patients if they can't communicate with them or they're waiting for an interpreter. So I think this is a place where small local communities or different populations need to work with allies to lobby together to get the services that are needed.
Thank you. And I'll just have one more question from the chat or the Q&A. Are health professionals trained in this topic as part of their community competence? And if not, how can we make sure that that happens?
That's a tough one. I think each hospital has their own culture, their healthcare system. Obviously, in the bigger cities where there's more diversity, the diversity is obvious. It's not difficult to find a language champion, somebody in a healthcare setting, whether it's a leader or a department that oversees interpreter services or that works with communities, grassroots organizations, community-based organizations, partners that have particular language needs, a community relations department. I've also seen language access under social work, and I've seen it under risk management. So under hospitality service, I've seen this in a variety of places, but this has been in the hospitals in the bigger cities. So, going back to what Rob said is, having allies, it is important for somebody to come into the hospital and say, hey, we have 100 different families in our community that don't speak Spanish. How can we work with you? Or how can you work with us? How can we train your staff a little bit about this culture and a little about accessing somebody who speaks the language of the patient? I myself know that, I've implemented a few interpreter programs in the Chicagoland area. So in addition to training interpreters, that's not where it stops. This question is a good one because you have to train the providers. They're 50% of that conversation. And say they not only need to know how to use an interpreter, they need to know how to access an interpreter. And what do you do when you don't have an interpreter in a particular language? What are the resources, so that you're a comprehensive program of on-site interpreters, of video remote interpreters, of telephonic interpreters, and even possibly volunteers for those smaller language pockets, but still a need. Every patient who walks into a hospital has a right to understand their diagnosis, their prognosis, and everything related to their healthcare.
One more thing, I know I said it was the last question, but just to summarize and think about this in an action step, we talked about a lot of how we can advocate for language justice, but what are other, besides the things that we have already been mentioned, what are other ways that people at home can advocate and be part of this fight to get more language justice for individuals during this pandemic and just in general?
So I'm going to step forward for a minute that I think we need to provide more support for families, right? That we know that children are acting as language brokers at home, at school, medical offices, at work. They're doing all kinds of hidden work. And I think that families need to be supported in finding access to professional interpretation when it's available, and also finding ways to support their kids, to recognize that don't pull your kids out of school if you don't have to. Like, kids need to be in school. Like, let's find you the resources to do that. At the same time, the kids also need some support in doing this. Like, they need the recognition that this is really hard work when you get dragged into a medical office. This is hard work when you have to interpret immigration papers at home. Like, this is a big effort. And in order for kids to derive benefit from that, they need that support. They need that praise for the hard work that they're doing. At the same time, I think we also need to reach out and support the communities that are there. That it's community, it's everybody. So if there's a language pocket in my area, that's still part of my community. So we have to work together in order to improve the situation. I'm a big believer that a rising tide lifts all boats, and those are the boats that I want to be in.
Well, for us as indigenous people, like people like the Latinx relatives need to work a little bit more on getting to know the diversity of Latin America. And as far and as Mireya said, it's the person like in the diversity office is that person that we do the outreach to. But when they say no, we just keep on insisting. I contact many hospitals a day, like, hey, you know, you have this population in LA County, and there's no response, and we're going to continue knocking the door until somebody hears us, because it's the only thing we have left, you know, in order to advocate for indigenous people's rights in the hospital settings.
I just want to add the one thing about the OCR, the Office of Civil Rights. If they find hospitals non-compliant to providing interpreters for in language needs, if you're found in violation, you could lose federal funding. So depending on how much a healthcare system or a hospital needs that funding, but I think most of us want to keep that and don't intentionally not provide interpreters, but that's just the way it's always worked in that particular area. But, you know, it's important to know that, you know, when a patient asks for an interpreter, they do have the right to an interpreter.
Thank you. Well, this was a great discussion. We would like to thank you, Odilia, Mireya, Professor Weisskirch, for bringing your expertise into this conversation and contributing to the next steps to ensure that individuals are receiving accurate information in their language, especially during this pandemic. This was an opportunity for us to understand the barriers that still exist and the impacts that they have in non-English speaking communities. Information in the language, the information that is needed in each individual language about COVID, about testing, treatment, can be detrimental to their survival. We are losing a lot of individuals, and some of that is because of the language barrier. We need to continue to advocate for language justice as it impacts our communities, because we are all part of this community. And thank you again to our panelists, to everyone at home, and Alianza for providing this platform. And again, this webinar has been recorded and will be uploaded soon. So if you want to share it with your network and ensure that they also know about language justice, it'll be greatly appreciated and encouraged. But thank you, everyone. Follow us on social media for any other webinars that we'll continue to advocate for. Have a nice day.